No, thank you all for being here. I suffer from irritability, fatigue, and low sex drive. Yes, I do. And these are just a couple of symptoms of obstructive sleep apnea. Hi, I'm Nico, and I'm here today to inform you about the 3 most common causes of obstructive sleep apnea. As a respiratory therapist for almost 10 years, I deal with patients with obstructive sleep apnea all the time, and I also suffer from it. Okay, and then I gotta get out my little noise thing here. Come on. I'll just make the noise here. Alright, that was a bad snore, but okay. When I do this at home, my wife thinks I'm sleeping well. Well, that just isn't true. Snoring is a byproduct of obstructive sleep apnea. And what obstructive sleep apnea is the sensation of breathing while trying to take a breath for more than, it depends on which book you look at, 10 to 20 seconds. Now, as nurses, you will be dealing with people with obstructive sleep apnea all the time. Some of them even have these causes for their obstructive sleep apnea. They are being overweight, alcohol and drug use, and the airway. Let's move on to being overweight. According to MayoClinic.org, copyright 1998 to 2015, fat deposits around the upper airway causes obstructive sleep apnea. In fact, if you look at me, I do not look overweight, but the BMI chart says I am, because I'm just under 5'5", and I'm greater than 166, so I'm about 20 pounds overweight. So, let's move on to alcohol and drugs, since we've already learned a little about weight. Using alcohol, especially heavily, just before going to bed, increases your risk of snoring or obstructive sleep apnea. According to Wikipedia, June 7th, 2015, the throat consists of soft tissue which can collapse. Alcohol reduces the muscle tone around your airway, which causes it to collapse. The sedation that you nurses give also reduces muscle tone around the airways. So you get medication, your patient snores, you did it. Now, let's move on to the airway and the anatomy. As you can see by my lovely chart that I grabbed from Yahoo Images, there could be many reasons why you can have tonsils enlarged, your epiglottis is inflamed, your tongue is large, mucus from the airways. Any of those things can cause obstructive sleep apnea. Also, from Oakes Clinical Practitioners Pocket Guide for Respiratory Care, copyright 2006, if your airway is small or unstable, that leads to obstructive sleep apnea. You can have tumors. And over here, anywhere in here, will obstruct your sleep apnea, your airways. So, now that we've learned a little bit about what causes obstructive sleep apnea, let's review what we have learned. We have learned that there are 3 major causes: being overweight, alcohol and drugs, and your anatomy of your airway. As an RT, I deal with this all the time. As a sufferer of obstructive sleep apnea, I also deal with this all the time. If you want to think of your airway here as a garden hose, and the flow of here as water, you will see that if you kink a hose, what happens? The water doesn't flow as much. Same thing happens with your airway. Now, I would like to thank everyone for coming, and remember that I have irritability, fatigue, low sex drive, all because of obstructive sleep apnea. And people with severe obstructive sleep apnea, if it goes untreated, they have a 30% higher chance of having a heart attack or a stroke. Thank you.
Let's see what.
We got all five. Thank you.